Good evening, friends. Good evening, D. Good evening, Vignesh Shantam. Good evening, Krishna Mohan. Hello, Bharat Baberwal. How are you all doing? Hello, Ajay. Good evening, Adi. Good evening, Sadaf Mamin. Good evening, Sukhbir Singh. The chance of exams on March is very likely because things are being updated. Many people are doing faster things. So on a war footing, people are doing things. So there's a very good possibility of having the exams in March. Hi, Harsh Kolpate, Sohini Sanyal, Anjal Roy, Rishu Singh, Utkarsha Singh. Good evening. Thank you very much for joining me at such short notice. I thought of doing this session only day before yesterday, and I was just having this idea. But many people were continuously asking me. When they come and talk to me in person, they'll be asking me how to stay motivated. So I thought, let me make a live session video. So before I say anything, would you have any questions to ask me? Please tell me if you have any questions, and if I am capable of answering them, I'll try to answer these questions for you. Yes, do you have any questions? Yes, very good. Samir Dasadia, Karunya Devraj, Apurva, Samir Dasadia. Good evening, all of you. Good evening. Thank you very much for joining me. So, do you have any questions to ask me? Tausif Ahmed, very good. Karina Jolly, God Gamer, good evening. Yes, I understand this is the thing of the day right now. So, before we start, let me show you who I am so that it will be helpful for you to listen to me. I'm Dr. Meenakshi Sundaram here, and I'm an NEET PG educator, and I'm an MBBS MD, gold medalist in MD exams and MBBS exams, and I'm an educator for Biochemistry and Microbiology for the past 11 years, and I'm successful in placing various students at the top level, and I'm a prolific quiz master too in the international and national quizzes. And there is something called as Plus subscription. Here you can have access to both live and recorded sessions, learn from India's top educators, compete in live and test quizzes. You can have multiple devices where you can use them. You can access the question bank, which has more than 25,000 plus questions of access. And there is something called as iconic subscription with Unacademy and Prep Ladder, and Academy Prep Ladder with Prep Ladder. And these are the special class features: interactive live classes, polls for learners, raise a hand session, never miss a class, lecture notes, and anytime, anywhere session. You can talk to the faculty directly in case you would like to have any questions by clicking on the raise your hand option. These are the toppers from the NEET PG 2021, and you can have a free test calendar, medical PG, and this is an announcement for you. Unacademy brings you medical PG tests. This is for the free sessions people, and this is for the plus subscriber. The free special subscribers can use Educator Curated Series, FMG Series, Study With Me YouTube Series, Saturday Special Series, and Grand Test Series. These are the timings. And for plus batch, which is showing as a locked session, is for the sessions for the people who are plus subscribers. These are the upcoming 2 batches that you would be benefiting from. And there is also something called as NEET PG Combat. On 19th December at 5 p.m. you have this. You can actually have a scholarship pool of 10 lakhs. You can get instant access and scholarship benefits, and valid from December 14th to 15th is this particular offer. Buy for 24 months, you can get 4 months of subscription free. For 12 months, 2 months of subscription free, and for 6 months, 1 month of subscription free. Please use code DRASM live to avail 10% discount and have exclusive access to all my past and the upcoming classes. And these are the charges for the NEET PG subscription. Okay. Yes, Harsh Kolpate. Sorry, your 10th standard students, so you can watch lectures for my studies also. Yes, this lecture is for motivating people to do their best, so you can actually watch it. Akul Bose, okay, NEET PG, batch for FM Microbiology. Yes, I'll try my best to get you this. So, if there are no other questions, let me begin. First, have a look at this. Can anybody tell me which OPD this is? Can you guess which place this is? This is a picture I took from the net, and I suppose this is supposed to be the Niman's OPD. Let me tell you, let me begin my whole session with my own personal experience. I suffered from neuropathic pain, for which I wanted a consultation from many areas. And after consulting with a few neurologists, I was given suggestions to go to the highest center of neurological studies. So they asked me to go to NIMANS. And when I was going for NIMANS, I thought it's a central government institute, so maybe it is a very tough area to get into it. I got some help from a DM resident. He was very sweet. He helped me get into the OPD. But when I went into the OPD of NIMANS, I was really surprised and shocked. I was humbled. Why did I feel so? Because there were 3,000 plus people at the gates of the OPD going in a very small queue waiting for people to actually entering into the OPD. And everybody was given enough amount of time. The consultants in the NIMANS OPD, be it neurology OPD or the psychiatry OPD or whichever course you are going into, the consultants and the residents were having a lot of painstaking efforts. They did a lot of things and they were patient enough to listen to every single person. It was not just the quantity they were dealing with, the quality was very high. The turnaround time may be very slow in these people because they don't do it for the sake of doing it. They do it because they want to learn and they also want to make the best for the patients. Now at this point of time, I felt like a small ant in a sea of patients. I may be a doctor, but I went in as a patient and I was one among the patients. And looking at the magnanimity of the number of people entering into the OPD and exiting, and I was looking at how the people were handling it, I really wanted to be in the thick of the action. The first time I actually thought I wanted to be a doctor. The first time I wanted to be a doctor was when I saw this kind of picture. There was a consultant who was a senior. There were two juniors walking with the consultant. The patient was lying down, and the other people who are trying to support the evidence, they all were having a conversation. This was the kind of picture I saw on the net, and when I went into an actual hospital in the government college setup, I was able to see such kind of rounds happening in and out. And I was wondering what this particular person might be talking to these people and what these people might be laughing and smiling about because the patient is also happy. And I have also seen conditions where people were very sad and the doctors were very grim. They were dealing with the patient. I really did not want to understand about my own self. I wanted to understand about my own body. This was the biggest motivation I had. Why? Because when I was 11 years old, I had some kind of burning sensation on my foot. It felt like some strong boiling water was trying to burn my foot in different areas when one or two drops of water was placed on my skin. That is how I felt. Now when I went to a doctor, he was just an MBBS practitioner. He was not a neurologist. He was not an MD pediatrician or anybody. He was just an MBBS doctor, but he was very skillful. And he had the guts and he had the privilege. And he asked me only few questions. And when he was asking me questions, he prescribed methylcobalamin to me. He said, there's a chance that you may be having vitamin deficiency. I was absolutely unfazed. I did not think that this particular tablet would be solving a problem because I had this problem for almost 1 to 2 weeks. I was wondering how taking these two tablets might actually make me feel better. I took these tablets. In the next 1 week, I was feeling better. I was slightly confused. I did not want to understand. I did not want to be phased. So I asked the doctor what exactly happened. He said the medicines will happen to work in such a way they'll try to cure me. I was asking him a question. I was taking the tablets through my mouth. How did they actually come and help me have a problem that was present on my wrist? And he said, when you grow up, you'll try to learn, or if you do medicine, you'll try to grow up and you'll learn. And I was very dissatisfied with this answer because I wanted to know what exactly was happening. And I wanted to know why my bladder was distending, and every time before I was about to micturate, how do I get the understanding? If I want to micturate, how did my body help me understand that I have to micturate? That is the point where I understand there was some kind of expansion reflex. Whenever the bladder was expanding or whenever my GIT, that is the rectum and anal canal, was expanding, I was having enough amount of motivation to see either micturition or defecation can happen. I was really fascinated by how my body works. And whenever somebody drew blood from me to any kind of investigations, I did not know what exactly the blood investigations can show me. But I was fascinated. At that point of time, I realized knowledge was superior to everything else. And thank you, Dr. CP. Yes, D is asking me a question. Hello, sir. I've joined offline face-to-face classes. I'm not able to go along with the classes. That itself is demotivating. How do I manage on class days? Should I do only notes or MCQs on class days? Vignesh Shantam says, Silla Jalandaman. No, that was the man. Sastvikraj. What keeps you motivated of teaching with so much passion? That's what I'm coming to. You're not able to focus and you're getting distracted. How to avoid that? If you're to give mock tests and GT in the fear of failure. Yes, understand it. See, before you think of things as going forward in the downward direction, first you understand the concept that knowledge prevails. Knowledge is of supreme importance when you want to become a doctor. Exchange of information should be what you're looking for, and knowledge is what you're trying to target. You are not supposed to actually feel more commercial at this point of time when you're trying to learn. Look at this resident here. She is very depressed even after so many number of hours. She might have had 70 hours of duty. But if at all I go back to this intern and ask her, okay, I'll give you relief from this. Do you want to take up another job? Do you want to actually move from this medical profession? They'll still say no. And if I'm giving them a chance to revisit their life and to start their life fresh once again they'll want to become doctors. Why? Because being a doctor by itself a passion, being somebody who can actually save lives is a greater deed than anything else. Now, can I tell you a story if you'd like to listen to? Can I tell you a story if you'd like to listen to before I answer your questions? Yes, this particular story is a fable. It happened in Siberia by word of mouth story. In Siberia, there was a young boy who had lost his mother and he was having only his father. And his father was also dead when he was 9 years old. And at that point of time, this particular boy became an orphan. And you know how these countries are when it becomes extremely cold. And when he was very, very depressed and he was walking very dejectedly into the houses, into the streets, one particular house alone opened for him when he was extremely hungry. He was famished and he was hungry. Nobody was opening the doors for him to feed him or to give him any kind of shelter or some kind of warmth. But there was a very young, sparkling lady who opened her home and she gave him some kind of shelter and she gave him some kind of warmth in terms of blankets, and she asked him to have the final glass of milk that she had for the sake of her daughter. And this particular lad took the milk, took the warmth. The next day he disappeared. And when he was walking out of this particular place, he realized if he had not gotten this milk or the warmth, he would have died because of starvation. He was very thankful to the person, but when he actually walked out of the door without thanking that lady, he resolved to himself. He decided to say that, okay, I got some kind of goodness from this person. Let me pay back the goodness as pay forward. I'll give the goodness to someone else. If these things happen, if at all at any point of time in my life I can become greater, I will use the greatness to help somebody else in trouble, like how this good lady was able to help me in trouble. Now this fellow started studying. He got scholarships and he was fascinated by the field of medicine, the way people are saved when they have ailments. At that point of time he decided he will study very, very hard, and one fine day he'll become a doctor. And when he became a doctor, he did not want to be just any kind of doctor or general practitioner. He wanted to be a specialist. And that specialist, he wanted to be a cardiothoracic vascular surgeon. And when he became that, he was doing many kind of goodwill works. One fine day, an old lady had come. She almost had her heart give up. An old lady walked into his clinic and he had seen her heart almost give up. At that point of time, the lady was telling the counter that she was very poor, she can't afford any kind of medical treatment. This person, as he has vowed for his rest of life, he decided that he'll always try to be the best for the people whenever somebody needs. So what did he decide? He wanted to take care of the lady. He did not talk to the lady directly, but he took the physical examination findings from others, and then he went behind her back and he scheduled an operation. And after the scheduled operation was done, the scheduled operation was a success. And when that successful operation happened, the daughter of this particular old lady was very, very happy, but she suddenly became sad and depressed. Why? Because She realized it was a very huge hospital, it was a corporate setup, and if at all this surgery had done well, then there is a very good expectation that the bill of the hospital will be extremely huge. And when the bill came to her, she had trembling hands and she accepted the bill. And the bill amount was running in thousands and thousands of whatever the currency they had. And at the end, it was a very huge bill amount. And there was a small statement saying that settlement. In the corner of the settlement, it was written, the bill was settled in full with a glass of milk 20 years ago. And that was the time the girl started crying, because this girl was just a very small girl in the hands of the young lady who gave him milk when he was actually sad. Why is this story important? This is a story of gratitude. Gratitude actually makes everything in our life beautiful. Gratitude makes all our life enough. Why did I say this? When you become a doctor, you can assume the greatest position ever possible to help someone in terms of need. That should alone motivate you to do the things greater. Now, can I ask you, who are your favorite sports people? Who are your favorite sports people? Can you give me names, people? Who are your favorite sports people? You can tell me whoever you feel like. Adi says MSD. Shivani Goyal says MSD. Yadav Akash also says MSD. Akul Bose and Tausif Ahmed are saying Cristiano Ronaldo, CR7. Virat Kohli, D says. Krishna Mohan says MSD. MSD says approximately 7 plus votes. CR7 has 2 votes. Virat Kohli has 3 votes. Sachin Tendulkar has 1 vote. Novak Djokovic has 1 vote. Ankush is also having voting for CR7. All these people are sports people. Now, when they try to perform, would you pay? Would you pay to watch them perform? Yes or no? When they are playing, would you pay to watch them perform? Yes or no? "40 minutes. 45 minutes. Yes. Yes. Would you want to watch them play? Why? Because their performances are amazing. Their performances are amazing. And when they do such an amazing work, it is beautiful to watch. It is so beautiful to watch that you would even pay to watch them perform. Why is this relevant? When I actually wanted to be a teacher, the first thing is that I wanted to see people find joy in learning. Medicine is supposed to be a very heavy kind of syllabus. It is one of the toughest courses on the planet. I can accept, and you all will accept, that medicine is one of the toughest courses in the planet. And many people will not agree to the fact that medicine people actually are yet rich or poor. Generally speaking, there are some group of doctors who are extremely having expertise, and they're also lucky. They make huge amount of profits. There are some doctors who are lucky. They may not have extreme amount of talent, but they can still make a lot of money. There are people who are unlucky. They may be talented, but they don't make much of money. But the single holding thread among common to all these people is that they all are doctors. They all are qualified to save lives. We all are beautifully happy to watch James Bond perform when he is at his prime. And he has a tagline called as, License to Kill. When we all love to watch movies which have a tagline called as License to Kill, can't we actually have the wonder to actually watch people save? You have license to save people, and that alone can motivate a medical student to become a great student. And whenever somebody do not understand anything, for example, when I was in my first MBBS, second MBBS, third MBBS, there were teachers who wanted to teach me. But when I didn't understand something, I was not able to approach many people to ask certain questions. So when I didn't understand things, I wanted to take things into my hands. So I decided to learn. I kept reading with vigorous amount of motivation. I was not always a very studious person. I repeat, I was not always a studious person. Now, for example, if I teach you 10 to 15 lines, meanwhile, if some other thoughts come into your mind and you're not able to register whatever I'm teaching you, it means the distraction was more powerful than my learning and my teaching and your learning. But even though if you're in a very crowded center and if you want to read an important line in the newspaper and the PDF file is sent to you and you are in a crowded railway station, you want to read that one single line, you'll search so vigorously, none of the other voices will mean anything to you. In a crowded area, none of the other voices will mean anything to you. Do you agree to that? In a crowded atmosphere, in a railway station, when so many people are talking, then so many people are making noises, it's hustling and bustling. But if you want to look at a PDF file and there is one single line you're searching for, you will never be able to focus on anything else but this. Now that is what is called as joy of learning. When you're reading something, when people, this is the answer to the question who was asked me before. They told me there is no focus. When I try reading, there is no focus. For that I'm answering it. When you're trying to learn something, learn it for the joy of learning. Learn it for the joy of learning and not just for the sake of getting marks or to get a rank in your exams. This may sound very philosophical. You may feel like, oh bullshit, I can't listen to whatever you're saying. Yes, that is possible. I can understand your mind voice. The truth is, if you start learning for the joy of learning, it may not be possible for you to complete the portions within the amount of time. But if you give it enough amount of time after you finish your MBBS, and if you give it enough amount of motivation, when you start learning things the beautiful way, nobody can ask you a question which you can't answer. That is what is your motivation. Let me tell you a small motivation I had. In my college, I was not a very vocal person. And I was actually an introvert. Because I was concerned about passing, I was concerned about learning, I wanted to do anything in my power to make sure I learned a lot. But I was also not having any kind of focus. And I definitely made it a point not to talk to the opposite gender or to make friends who are extremely happy. Because the moment you slip into the friendship where other people are enjoying, your heart wants to enjoy doing things which are actually liberal rather than to come back and become conservative and start studying. So I did not have much of an interaction. But there was this one girl in my class who found my silence fascinating. I do not actually look good at all. I never looked good in my life. I am not a good looking person. Even if you give the best kind of outfit for me, I will be maximally average. I was never a good looking person. But this girl was a very pretty girl in the class and she had a lot of suitors. She wanted to have an interaction with me one or the other time when I come across each other. I was silently feeling proud of it, but I was always having a question, why is this girl interested in talking to me? The point was, I was borderlining on ugly to average, but she found my passion for studying fascinating because she herself was not a studious person. But I wanted to be a studious person and she always was curious to know what I learned that day. How I was a better person than her on that particular day, every single day. So she'll come up with some of the other new questions to me. She'll ask me one of the other questions. Now, the first 4 days when she asked me questions every single day, I answered 3 out of 4 questions correct. I answered her questions. I gave her the impetus. Yes, I gave her the impetus. I answered 3 out of 4 questions. And for one question, I asked her, give me some time. Give me some time. I'll find the answer for you. Within 24 hours, I was able to find the answer. That was not the age where the information was available very easily. That was not the age where apps, online platforms were not available. We had to go to the physical library. You had to open up the books. The library was supposed to be a huge library. I came across at least 7 to 8 books within 24 hours. It was not even 24 hours. I just worked only for 2 hours. Normally, I wouldn't have found the answer for such a question because I wouldn't have come across such question. And even if I had come across such question, I wouldn't have had so much amount of girth in going behind the answer. But because this girl trusted me every single day, and every single day she came to me with one question, I was motivated to find the answer. It might have been because of infatuation, but I was not actually shy enough or I was not rude enough to actually accept it. So I was trying to answer her questions. And one fine day, I and she were talking in the corridor against the library. there was another senior of mine who was walking inside, and this senior told her that I was a studious person. She said yes, she knew it. And he was asking her, how does he find this boring person interesting? She told him she considered me as an encyclopedia of medical field. And what was I? I was just a first year student who was not even having enough amount of time to prepare for my exams, and I was just bordering around 60 to 65% in my internal exams. The moment she called me an encyclopedia of medical field, I was not actually feeling like I was floating in the air. I had an impinging amount of guilt. I decided I have to find a way to make her words come true. I did not think that I was an encyclopedia. I would never imagine myself to be an encyclopedia because I didn't know much. But because she believed I was an encyclopedia, I made efforts to become the encyclopedia she was. So whenever there was a question, whenever people asked me questions, I did not ask questions to people. I found answers to the questions of people. I found answers to the questions of people. And this is the point which changed my life. The moment I asked questions to people, people were not ready to give me answers. Everybody, that is, they neither knew the answer nor they were interested to share the answer. So I decided to be the person who will be the answer to everyone. That was the first motivation I ever had. Now look at this OPD here. This is the OPD when I came across when I went to the hospital when I was young. And because there were so many people waiting outside for a doctor, I wanted to be that doctor who was able to examine these many number of people and dispose them every single minute and say, take care of yourself. And when I saw questions about surgery, I saw surgeons in action. They were able to wield a knife. Here you're looking at the laser pointer, and they were using an endoscopy here. And I saw surgeons using blades and scalpels. I realized that they had the license to cut open a body and to learn what exactly was happening. I did not become a surgeon. Later, I did not even want to become a surgeon. But I realized that surgeons are the worst kind of people. They may have God complex. They say surgeons have God complex. Some people say surgeons are arrogant and they actually do what they want to do. But the truth is, when you really are in deep shit, you want these kind of people to be on your side to work for you. And that is when you will be able to save lives. And if you are the person who is able to save that kind of life, and you are the person who wants to be the person who saves a life, then what greater than it can be? Look at this. This is the AIMS. This is a premier institute of the nation. And if you would actually do any kind of course here, it may not be just because of academics. It is purely because of the exposure you have compared to any other kind of hospitals. And when you come out working from here, can you actually believe that you will be having lesser number of things that you do not know and more amount of things that you know? That alone motivated me at any point of time. What do you mean when I was young? You're still very young. Satvik Raj, you're very kind. I am 36, 1/4 years right now. And I mean, I'm already middle-aged person. I'm in the early middle age. I have midlife crisis already. When I was 11 years old, when I was 15 years old, when I was 20 years old, all these areas, many kind of places gave me goosebumps when where doctors were becoming great people. Doctors were treated with enough amount of reverence. Many times you'll come across places where doctors are stoned. Doctors are pelted with stones. Doctors are ill-treated. Doctors don't earn a lot of money. But a doctor is still a doctor who can save lives. For example, you walk into any place, there are many people from different professions. You call an engineer and ask, what do you do for a living? I build houses. You ask a teacher, what do you do for a living? I teach people. You ask a farmer, what do you do for a living? I feed people. That is great. And when you say doctor, if they ask you, what do you do for a living? You can proudly say, I save lives for a living. Not many people can call this, not just a doctor, nurse, paramedical personnel. They all save lives for a living. And that is what is magic. Magic is in your veins. Magic is in your blood. Once you become a doctor, once you enter in the field of medicine, MBBS, the PG seat may be delayed, but never denied. It can never be denied. You just have to have perseverance. You just have to have perseverance. And somebody asked me, How did I actually gain the interest to teach? What was my passion? When somebody who did not understand that particular topic, and if I teach him that topic and his eyes glow because he understood something new, then that gives me the complete kind of satisfaction I ever want. And I wanted to have the satisfaction for the rest of my life when I was young, between 21 to 22 years of age. So I started teaching when I was a second year MBBS student to all my classmates. But I started teaching other people who are from different kinds of colleges when I was 22 years old, and I became an entrance exam specialist from 23 years of age until now 36 years of age I've been teaching. And sometimes I might be slightly bored, but many times I have the fire burning inside. Whenever somebody says, sir, this is a very challenging topic, can you teach me? And if at all I have known this topic, I become extremely excited to start teaching. If I don't know the topic, I am still excited because I will go learn the topic and then I teach the person. That was the one thing that was motivating me head and tails. That is what keeps me going even today. And when I run a quiz contest, it was like asking questions to people. I love asking questions to people when I know the answers. I hate asking people when I don't know the answer. I repeatedly telling you, listen very carefully. I hate asking questions to people whose questions answers I do not know. But when I know the answer to certain questions, I love questioning people. Previously, I think I was sadistic at some point of time when I was an MBBS student, because when I ask a question and the other person does not know the answer, I felt happy. But slowly, it was not sadism. It was a deep-rooted love for medicine. It was a deep-rooted love for medicine. So when I ask a question and the person knows the answer, I can discuss more with the person. I can learn something from the person. But if the person does not know something about it, then I start talking like an open tap water and I keep on pouring my information until he gets bored. Either he gets bored or he starts running away. I keep talking. That is the amount of information I want to know about a topic. For example, if I say, ask any question in the field of medicine I'm teaching, ask a question in biochemistry, ask a question in microbiology, you ask me, 90% chance I'll be able to give you the answer, not because I'm great, not because I'm intelligent, not because I'm a superstar, purely because I have invested that much amount of time in my life chasing answers for questions. Whenever somebody asks me a question, I'll find the answer or I'll have an answer. So the more I become older, I want to be the person who will always have answers rather than the person who actually runs for finding a question. And if you could be that kind of person, you will always feel good about yourself. How do I maintain work-life balance? I actually have imbalance. I have imbalance. Most of my personal life does not exist. I always have only my professional life. You have an 8 to 5 duty that I run for, and later I'll be having online classes which I'll be teaching for, and I'll be having consultations that I do for free. I'll do free consultations for people in such a way whenever somebody has questions. I have been a person who has been motivating others, right? So when somebody sends me a message and I look at the message, if I don't see the message, it's fine. But if I see the message and he wants help, I would find ways to help him understand the trouble. I'll find ways to have him a solution. And he has a solution, he feels better, that gives me happiness. On that particular aspect, many times I lose my own personal life. It doesn't still bother me much, and I wish that the bother doesn't happen faster for me. And when I do free consultation and I do paid online classes and I do my duty, my time is completely locked up. This is how my life keeps on going on. Sir, how to revise microbiome in 4 to 5 days on revising which areas to focus more? See, I'm answering Saurav Chaudhary's question. Microbiology is not just one subject. It dilutes or concentrates to become infectious disease, and once it becomes infectious disease, it is a part of your pathology, it's a part of your gen medicine, general surgery, pediatrics, ophthalmology, ENT, OBG, and most importantly PSM. And if you want to learn about the physiology of a bacteria and the biochemistry of a bacteria, it can involve biochemistry also. Why did I say all this nonsense for your question? Because microbiology is not just one subject where you want to get it done in a matter of 4 to 5 days. If you really want to get the infection based questions in all these subjects correct, mark my words, in every field, whatever field I showed you here, if I bring in 100 patients, out of 100 patients, 70 patients would be filled with infections. Don't you agree? Answer this question, Saurav Chaudhary. If I have 100 cases put together in all these subjects, all these departments, you will very well be able to accept the fact that at least 70 to 50 patients will have infections. Yes or no? So, reading microbiology within 4 to 5 days should not be your target. Reading microbiology in such a way, you understand the clinical relationship between symptomatology, watch my words, symptomatology, pathogenesis, and virulence factors of every microbe. I repeat, you have to understand the morphology of a microbe. For example, gonococcus, meningococcus. Both the dangerous bacteria come from the common genus called as Neisseria. Now, the gonococcus is also a Neisseria, meningococcus is also a Neisseria. But when gonococcus affects a human being, he has gonorrhea, it's a type of STD, and it affects your genitourinary tract. But if it's meningococcus, it is inhaled, it enters into your nose and goes into your brain. The human being is the same, but these organisms are morphologically different. The way they are acquired by your body is different. The pathway they choose to attack will be different. Their pathogenesis will be different. Why is their pathogenesis different? Because their virulence factors are different, because of which their symptoms will be different. And when their symptoms are different, the part of your body being attacked is also different. So for a person who has an STD or urethritis, you collect urine sample, not the CSF. When a patient is having meningitis, you collect CSF, not the urine sample. That decides what kind of investigation you will run for that kind of patient. That decides the strength of microbiology, not just as one subject, as a part of infectious disease protocol. Did you understand this question, people? Satvik Raj, the people who are doing DM hematology are mostly from pathology. Even clinicians are allowed to do DM hematology. When I was entering into MD Biochemistry, that year DM hematology people are allowed, DM hematology we were qualified. But later it was removed. Again, this is a controversial question. Nobody is very clear whether DM hematology exam can be given by MD Biochemistry people. Always keep your options open. But if at all there is a chance, take it. You will be always happy in life. Sir, how should I revise biochemistry? Good question, Rishu Singh. Revision of biochemistry. First, you start with vitamins. People always think vitamins is actually a miscellaneous chapter. People think vitamins is supposed to be a miscellaneous chapter. Absolutely no. It is not correct. Vitamins are supposed to form the core of biochemistry in terms of metabolism. Let me give you an explanation. For example, I speak about niacin. You say niacin is vitamin B3. You'll speak about the sources. Then you'll speak about the biochemical functions. Then you'll speak about deficiency manifestations. Then you'll speak about the RDA, recommended daily dietary allowances. But these are only capable of fetching you answers for 2-mark questions or 5-mark questions. Don't look at it that way. Look at niacin as the basis, as a cofactor for biochemical functions. The niacin's active form is nicotinamide adenine dinucleotide or nicotinamide adenine dinucleotide phosphate, and these are the ones who run 90% of your biochemical reactions if they are oxidoreductive enzymes. Now, in case of glycolysis, you will be having NAD. In case of HM patient, you will be producing NADPH. When you read niacin properly and its functions, you will know what kind of chemical reactions they will catalyze. When you go for riboflavin, riboflavin's active form is FAD, FMN, and these two cofactor forms of riboflavins will determine many other biochemical reactions. And when you start doing these, you'll understand the basis and the reasoning and the mechanistics of many chemical reactions. And when you start doing it and then go back to metabolism, and when you go for metabolism, sometimes you may not be very good with the structures. For example, C2H5OH is actually ethanol. But you also have to agree to the fact that CH3O, CH3 also has the same structural formula, but different, I mean, same molecular formula, but different structural formula. This one is actually a dimethyl ether. Now, when people have difficulty at this level of chemistry, then metabolism can be slightly difficult. While you're learning metabolism, go back to chemistry of each of the compound. For example, metabolism of lipids, go to chemistry of lipids. Metabolism of carbohydrates, go to the chemistry. Metabolism of amino acids, go to the chemistry. And when you're done with this, put a full stop and then start with genetics. When you go for genetics, start by understanding the basics of replication, transcription, translation which you learned in your school, and then go for molecular techniques. And when you're done with this, your revision of biochemistry will be over. Did I answer your question, Rishu Singh? Anil D. Eraya, I am particularly not aware of any recent updates in next exam. If that happens, I'll try to share it with you. How to keep going when we are exhausted? My mind keeps muttering to take rest when the target deadline is very close. Yes, D, your question is an amazing question. Can you recollect what we did? Can you recollect what we did in college? In school, we were amazing students. We were brilliant minds. People thought we were straight rank holders, national rank holders. But when we came into college, many times we were humiliated. We were humbled. We realized that we were not as great as students that we thought in school. We started accepting the fact that college life is difficult. We accepted the fact that we were not as great. But the truth is, we made a silly mistake. In school, we worked harder and hardest. But in college, we decided that we already were great people. We started working lesser and lesser. Imagine how many number of hours we worked before our 12th standard board exams. We might have worked for approximately 9 hours to 10 hours because we want to finish the portions. We finished the portions 2 months ahead and we kept revising the same subject again and again because we wanted a chance to get into MBBS. But once we went into MBBS, have you ever realized that many times we finished the portions before the day of the university exam? Even if we finish it before at least 1 week before the exam, we never had enough amount of time to revise. We never had enough amount of time to revise. Now, when that happened, we became completely different people. Sometimes you realize that for the tomorrows, if for example, tomorrow there is an internal test, and for that internal test, if we have 5 big chapters and we have done only 2 chapters, we have to pull out an all-nighter. We have to read for at least 10 hours to go through the remaining 3 chapters. We'll go have coffee, we'll discuss ourselves, we'll motivate ourselves. At the next 1 hour of reading, we'll become sleepy, we'll fall asleep, we'll tell ourselves, okay, let's bygone be bygones, let this test be gone, I'm giving up on the test, and we sleep completely relaxed, and then we go to the exam. We may pass or we may not pass, but we'll keep all the things to the study holidays. Is it not D? Is it not D? D. Many times we actually are supposed to work more, but we give up and start sleeping happily. Have you not done this, any of you? Yes. So what happened? We gave up on it. Slowly things kept on happening. Shanmati Karthikeyan has asked another question. I'll read the question. Wait a minute. Before I finish, let me tell you about the question raised by D. So at this point of time, we started becoming exhausted faster and faster. D had asked the question, when we are exhausted, how do we take rest? When you are exhausted, please take rest. Don't push your boundaries ahead and ahead unless you're giving your university board exams. If your university board exams you are not supposed to push, then you may fail. You can have backlogs. Having backlogs by itself can change your life forever. there is a gross difference between the people who are mainstream candidates and those who are supplementary students. There will always be some kind of animosity between them, and the supplementary batch students at the corner of their heart will always feel like they're not the same as the mainstream students. So for that reason, try your best to be in the mainstream. If at all you have a backlog, it doesn't matter. Life does not end there. But once you finish your MBBS, if for example your target is NEET 2022, take your time, read properly. First, if the target has come very closer, take abundant amount of rest for 2 days. Switch off all the mobile phones or any kind of devices which can bring you back into the equation. Yes, bring back the equation. Just forget about everything. Now, be absolutely still. Do not do anything at all at home. For 2 days, do not watch movies, do not go outside, just sit and take relaxation. Be relaxed every single minute. Now be so relaxed that you get bored. And that boredom can give you some borderline anxiety. Then you start preparing. Then you start opening your books. When you start opening your books, remember, while you're enjoying watching TV in all these times, you will not be scared about your exams. But the moment you open the first page of your book, all your fears will come popping out, is it not? Do you agree to this? When you are watching TV, talking to your friends, making a phone call, you don't actually feel so scared. But when you open the book, that is the time fear pops in, is it not? Don't you agree to this? Yes. Why? Because book is a mirror of what you have worked. Book is a mirror of your hard work. The more the number of pages in your books are absolutely new, the higher the level of your anxiety. The only thing you can do is put your head down. Do not worry about what the results are, because the more you panic about the results, the lesser you perform, the lesser you study. Then what is the point of actually being panicky in the first place? Panic is supposed to be a protective mechanism. The anxiety is supposed to make you a better person. It should be guiding you in the proper pathway. Just because you're always anxious and you're not able to give your best into the hard work, then your hard work goes into waste. Do not be that kind of person. So when you're scared, feel completely scared. When you think everything is lost, just close your eyes and pray to God if you are not an atheist. And if you are an atheist, do not worry about anything else. Just tell yourself everything was your mistake. Consider whatever mistakes you did, leading on to be a person who did not actually have enough amount of chances to study. So think about all the times you wasted not studying. At some point of time, you'll realize out of guilt that a small amount of sadness creeps into you. You may start crying. And when you start crying, that is the point you're going to let go of all the pain that you ever had. Cry completely for at least 15 to 20 minutes. But once you stop crying, never cry again. Cry completely, and then your heart becomes lighter. Then you open your book, tell yourself whatever you're going to study is for your happiness. We know studying for the topic for understanding is important, helping us in the long run. See, if your exams are nearer, your target is to finish portions. And for those people who can't finish portions, ask yourself whether the number of hours you have is adequate. The number of hours you have, is it adequate? Now, if at all, you ask yourself, in a day, if you have 24 hours of time in a day during your study holidays or during your preparations for your exam, ask yourself how many hours have you put actually into sitting with the books. You can sleep for 8 to 9 hours, even 10 hours, spend 3 hours for your own happiness and for self-care, remaining you have 12 hours, sit with your books for 10 hours, at least have the knowledge entering in your mind between 8 to 9 hours. If you could do 9 hours of undistracted learning every single day for a period of 120 days, you have 12 nines are 108, right? So you may have 1080 hours in your pocket. Divide the 1080 hours or 1100 hours into 19 subjects. You obviously have more than 30 hours or each subject. That is more than enough to finish the portions once. And if your exams are very far away, spend at least 40 hours for a subject. And if at all you have 10 chapters in a particular subject, spend at least 20 hours in a subject to try to read it and understand it. The more you understand it, the level of your preparation and your understanding will become greater. Did you understand this? Rishu Singh has asked a question. Sir, I gave first NEET PG attempt with all my enthusiasm and preparation, but I'm not getting branch of my choice, and now I'm not able to give my best every day. I'm not able to give my best every day. Good, Rishu Singh. I'm asking you a question. When you are giving your complete enthusiasm and preparation, did you read for 12 hours of undistracted learning? 12 hours of undistracted learning. Did you have 12 hours of undistracted learning? It means for getting 12 hours of knowledge, you should have sat for at least 14 to 16 hours. And did you do 12 hours of undistracted learning, Rishu Singh? Yes. So now try this. See, your personal fear is that you have given your best. That is what your mind is telling you. In spite of giving your best, if you are not able to get the seat of your choice, then you think you will never be able to get what you want. But I'm telling you, there is still room for your improvement. There's still room for getting what you want. Now, if at all you had 7 hours of undistracted learning, make 7 hours into 12 hours this time, and you start putting your efforts for the next NEET 22 exam, I can give you my word that you will be getting the seat of your choice. I'm telling you this, trust me. Make it as 14 to 16 hours of working, out of which 12 hours of undistracted learning, and then ask yourself if you don't get a seat of your choice. Yes. How to study medicine and surgery and how to revise properly within his subjects. See, medicine and surgery are vast. So what you do is pick up a chapter, look at the most important paragraph headlines and try to read the ones which are absolutely new to you. Medicine and surgery would have already come into your mind a lot of time. Do not spend time on reading the things that you already know very well. So look at the most important headings and see which headings you will not be able to answer anything. For example, they say cellular fibrosis, or they say hepatic cirrhosis. You can think of yourself, can I write at least 20 points when they speak about cirrhosis? If you think you can't write 20 points about cirrhosis, then you open up the topic about cirrhosis. After reading about cirrhosis for at least 1 hour, pick up an MCQ book and then go for the medicine MCQs and try to solve questions in liver cirrhosis, and try to solve them for the next half an hour. Now you will realize whatever you learnt in the 1 hour was adequate or not. That will push you to know where you stand. Keep doing it for all the subjects. You will not be a loser. You will always be a winner. Okay. Madhuman Gautam is asking how to study pharmacology. For pharmacology, first focus on the physiology aspect given in the chapters of pharmacology. For example, if you're trying to read about a drug like propranolol and you want to learn about pindolol, you may say both of them are beta blockers, but you have to understand in the beta receptors you have beta 1, beta 2, beta 3. If I excite beta 1 or beta 2 or beta 3, what are the results? First you have to be very sure about what the results are by learning the physiology. Then you ask about propranolol, which can act on all the beta receptors with varying kind of intensity, and then when you come to pindolol, ask yourself pindolol will act on what? It will be a small request statement saying that pindolol is also a sympathomimetic activity. Even though it is a beta blocker, it may have sympathomimetic activity. That will be understood by you when the core physiology is already good for you. So prepare with physiology and then go for pharmacology. But before you start the pharmacology aspect, learn the classification of each drug very properly. Then you step into the drugs. And when you go into the drugs, focus on mechanism of action. If at all you pick up pharmacology and then you focus on the treatment, then you focus on dosage, the dosage will look like numbers and the numbers will scare you the most. Even in secondary MBBS, if you write the dosage wrong, nobody will be very angry with you. But people will not be giving you marks if your classification of drugs is wrong and the mechanism of action of drugs is wrong. So pharmacokinetics and pharmacodynamics are important than that of dosage. When you start looking at the dosage and try to memorize it, many of you will be scared of pharmacology. Don't do it. So the first thing is read physiology. Second thing is look at the pharmacological classification of the drug. Then look at the mechanism, and then that mechanism will tell you what is the effect and what is the side effect. Pharmacology is done for you. How to study anatomy? Nana NEET PG is asking me. See, when you're trying to read anatomy, the most horrible thing that can happen through the theory of anatomy is to learn about relations. When they say a nerve is running antero-inferiorly and then turns supra-medially and then goes laterally and under this and over that, it will be confusing to you unless you can visualize it in the 3D. So forget about relations before you start anything. For example, you learn about a muscle. The muscle's origin you'll be learning, then you'll be learning about the insertion, then you'll be learning about the blood vessel and the nerve supply. When you do all these things, you read the theory part. Do not depend on the pictures given in the textbook alone. Open up Frank Netter's atlas. Open up Frank Netter's atlas and look at the bigger picture. First in the form of dissected area, the second in the form of cartoon area, the third in the form of drawing area. And every time you read this, look at these three pictures and tell yourself whether the picture information and the theory information are going hand in hand. When you are convinced these two are in harmony with each other, then you'll never have doubts in it. You will not forget this particular topic. And once you do all these, once you do the thing for all the kinds of topics, then come back to the same topic to revise. And when you come to anatomy, revise 2 to 3 times. It will be more than enough. You will get a distinction of your choice. For studying for today's test, we skip the daily portions covered which get piled up, haunting us again in the future. Procrastination now for today's test causes another in the future. What to do, sir? This is not your only problem. This is not your only problem. This is a problem of every medical student, and that is a problem of the medical field. Whenever you say procrastination happens, whenever you say you are actually studying for today's test and the piling up happens, ask yourself whether you have the guts. You actually apply brakes at a regular interval. Just apply the brakes today. For example, if the test is over, for example, a model test is happening for 15th, 16th and 17th of December, start from the 18th of December. On the 18th of December, instead of relaxing and going out to party, spend 3 hours of time purely reading. 1 hour for each subject. Or if you do it for 4 hours, 1 hour for each subject in case of second year. Read for 1 hour. Now on the 19th and 20th and 21st, keep doing the same thing. Then you keep on stepwise increasing the number of hours. Increase the number of hours if you're a medical student to 7 undistracted hours, and then ask yourself whether you'll be lacking back or piling up. So cut it. When you're going through a bad phase or a bad vicious cycle, cut the cycle. Stop at the end of the first test that you gave. Immediately start preparing from the next day after the test. Do you know when is the best time to study for a particular topic if it is given for a test? It is not the day before the test. It is the day after the test or the night after the test. If at all you have portions on limbs, upper limb, and if you have prepared for the upper limb test the day before, you might have actually pulled out an all-nighter. But the best time to read the topic of upper limbs is the night after the exam. Why? Because you went to the exam hall, the exam's questions were seen, and you were not able to answer it. Now when you open up the books, every single line will make sense to you, and you will ask yourself, oh my god, I missed this. Oh good, I wrote this. Oh, I missed that. Oh, I wrote this. At that point of time, things will fall in place. Your mind will be maximally receptive. Instead of going out and partying, come back, sit for the first 2 nights and then prepare. Then you will never make a mistake in that. Have I answered your question? Ghazal Kirtika, Rishu Singh, Anil, Sudafedrin. I hope I gave you answer. Mubashirly, how to deal with the uncertainty aspect of medical exam, because no matter how much you study, there will always be more to learn because MBBS syllabus is so huge and it's impossible to know everything. Yes, see, nobody will point fingers at you and say you are not knowing everything, but you have to know something about everything in your undergraduation. You should know most of the things about something in your post-graduation. You should know everything about the most minimal thing in your super specialty. For example, there are hand surgeons. The hand surgeons might actually come from general surgery or orthopedics. While they were general surgeons, they'll be knowing much about the surgeries everywhere. But once they become hand surgeons, they might have forgotten a lot of things about surgery in other places than hand. If you are a nephrologist, you will be knowing every inch about the nephrons, but you may not be knowing everything about the cardiovascular system. So in the field of undergraduation, you please know something about everything. But in super specialty, know everything about something. And for that reason, please keep working harder. Every single day, do your best. Things will happen on its own. The only thing is, raise the number of working hours. All your problems will be solved. If at all you are a very sharp student, first sit down to study. If you're not very sharp, you think your IQ is less, or you are a hardworking student, then hard work is on your weapon. You start working more than expected. Your answers will be solved. Yes, after a very heavy duty day, you'll feel like so down. If at all you have a chance of applying leave or you can cut classes, then definitely do it. Sit back, relax, and do whatever you want to do for the whole day. And then you will get bored of doing that. Please don't do it for more than 2 days because you'll get used to it. Please completely relax for one whole day, and when you start getting jitters, start working again. That is the best thing that I can do you. Yes. So for similar questions, I have given the answers in all the previous areas. You can have a look at it. So I'll do this. If you have any, I'll take up one last question before we wind up. Tell me if you have any other question. I have 6 to 8 books in each subject which I have bought as they are all good. I just wish I could learn all but could not cover more than one. This creates stress that are not good and self-hurt me. Yes, GK, I understand, but don't do this. Now what you do is, you may buy 2 to 3 books for each subject. Now don't do that. Pick up one book as your basic study book and one book as your reference book. Do not buy 6 to 7 books, because you know for yourself you would not be covering all the books and you not even be opening certain books. If you want these kind of books on certain topics only, go to the library and make the best use of it. But have one book for basic learning and one book for references. This reference also should be done when you're reading basics. If you want to know something more about this topic because your teacher told you the topic is a high yield area, then go to the reference book and take the extra information and write that in small letters in the book itself. It's a bad practice, but it's a good effective practice. Why? Because you keep up one book for each subject and then keep adding information from outside book into the same book. Now after reading this one book once, then you read the book twice for revision. And when you go for the exams, day before the exams, when you read it again, it carries all the information necessary. That is one of the best ways to move forward with your success. Why? Because when you have 6 to 8 books for each subject, you will only have panic. But avoid all the panic. Take up one book for a subject. If you have 4 subjects in one particular year, you decide which book you're going to read the whole year for one book. You can trust any book for that matter, because no book is going to be very bad, so that you'll get wrong answers in your exams. Trust any book. Now pick up one book for each subject and then look at it for 1-2 minutes. And after you read it for 2 minutes, look at it for 2 minutes, you tell yourself, only this many books. If I can read them once before my exam, I can pass. So that is your first step of motivation. Every single day, read at least 10 to 15 pages from each of the book if you are in your preparatory phase, and keep doing it for the next 6 months. Nobody can beat you. Yes, I think I have given you the answers. So for all those people who have joined me in this particular session, all the very best. Remember this golden rule. Whenever you feel frustrated, you ask yourself, you are a doctor, you are born to save lives, and you have a chance to save lives. And if at all you can save others' lives, there is a very good chance you can save yourself also. So don't worry about any other disappointing things. You may be sad at some point of time. You can always bounce back with your knowledge. You can become the kind of person you want to be. And when you start discussing things, you will always be the best in your core of your mood. I wish the best for all of you. All the very best, people. And if you like my question, if you like this session, please put a thumbs up. It can help other people watch the class. Thank you very much. Good karma will come back to you. Good karma can always help you. Thank you very much. Good night.